Welcome, everyone. I'm Liana Lianov. I'm the president and founder of the Global Positive Health Institute, and this is our podcast series that examines all things related to positive psychology and healthcare. And I'm delighted to have with us today as our guest, Dr. Ifeoma Monye. She is a chief consultant, a family physician, and she's board certified in lifestyle medicine. She joins us from London in the UK, but she also has connections to Nigeria. She's the president of the Society of Lifestyle Medicine in Nigeria and also the African Lifestyle Medicine Council. So welcome, Ife.
Thank you so much for having me, Liana. I'm delighted to be here.
Wonderful. So we'll always just dive right in and just tell us what got you interested in lifestyle medicine. And of course, positive psychology relates to positive lifestyle medicine and all things in medicine. So tell us more about how you got into this.
So my story is very exciting to me anytime I think about it. Right from the time I was a very little girl, maybe even as young as 4 years old, I always remember saying to my parents that I just want to see people healthy and happy. I just want to see people not in hospital at all. My grandma at the time, and I said this to my mother, I remember when we went to visit my grandma in hospital, and I just walked away saying to her, you know what, when I grow up, I just want to make sure that people are doing well, people are not falling sick. Look at grandma, she's so poorly. I just want to help people. So that has been, and I was 4 when I knew I wanted to be a medical doctor. And I think that at that point, I thought that that was the way I could achieve my meaning in life, if you like. I wanted to do that. And so that was the root of my interest in anything medicine. But as I got on to medical school, I realized that all we did was cure, very, very little on preventative medicine. But that was my passion. But medicine was the closest I could get to achieving that, so I carried on. But I know that as I carried on, I had this nagging feeling that, you know what? I just want to help people not fall ill. I don't want to see a father, an uncle, a son, a grandfather come through my clinic with, diabetes, with heart disease. And, I just want to see that the son or the grandson doesn't get it. But I didn't know how to figure that out. But after I graduated as a medical doctor, I began to research. I began to just find out, is there anybody thinking like I'm thinking? And I was very keen on sports as well. I did a lot of sports. I won a lot of medals. And right after medical school, I went to do a master's in sports medicine. And that was in my quest to find out that these things are necessary for well-being. Until I stumbled upon American College of Lifestyle Medicine in the early 2000s. They started in 2004, but I didn't discover them until maybe 2 or 3 years later. And then I said, oh my goodness, these people are talking like what I believe. And in 2009, I joined the college, and I used to fly from Nigeria all the time to the different meetings. I was in Harvard, at the Harvard teaching. I just was seeking this knowledge, and I found my tribe. So that was my interest. That was the beginning of my interest in lifestyle medicine. What about positive psychology? Now, that came along. I remember I said I wanted people to be happy. I was a happy person. I'm still a happy person. In fact, 2 weeks ago or so at the British Society of Lifestyle Medicine conference, after I gave my talk, everyone that came to say hello to me afterwards said, you are just a joy magnet. People identify me with joy, So I got that name. I got Christine the Joy Magnet. I've always liked to be happy and other people to share this happiness with other people. So as I carried on with lifestyle medicine, I began to ask myself further questions. Which area in lifestyle medicine is going to pitch me rightly into this? The events of my life, from primary school through secondary to medical school. And when I graduated and became a doctor and got married, the events of my life and the way I was able to cope with those, with my, would I say character or personality or whatever, really showed me that I innately understood the power of positive psychology and positive health. It is now that the PERMA model by Martin Seligman really put it all together for me that, you know, all these things that have helped you to cope have been about your positive emotion, about your relationships, about meaning in life, which the Japanese call ikigai, and about achievements. If you look at all of that, you know, positive emotions, E stands for, what's that E? What does Martin say?
Engagement.
Engagement,
right?
exactly.
Yes.
Engagement. And then relationships, and then meaning to life and achievement. That is just my life packed together. And I've been riding on storms, different kinds of storms in life, including getting married and not having children for 4 years. And today I have 4 children, but I've just been riding on storms, and it will seem like every storm is just getting me ready to push me onto the next level of resilience, and beyond resilience, to thrive and to flourish. So that's been my story, and it's exciting, and I'm so excited. I mean, you've got me in the right spot. This is all I like to talk about.
Terrific. And you've described it so well, that as we face adversity and challenges in our lives, and then we fully apply our character strengths and other aspects of positive psychology, healthy habits, we not only stay resilient, which is great, but we can actually grow and become even better versions of ourselves. And the other important thing that we always try to point out in the Global Positive Health Institute is, because our title is Positive Health, is that it's really achieving this state of positive health is achieved by lifestyle changes that are healthy, plus these kinds of positive psychology approaches equals positive health, which is even achieving a health and state of well-being that is more that we can achieve from addressing traditional risk factors. So these positive psychology approaches are protective, independent factors that contribute to our overall happiness, physical health, well-being, and what we call achieving total well-being or positive health. And you mentioned some of the PERMA elements of the model by Marty Seligman. And there's so much more to it that we can unpack. And there's quite a variety of these, what we call positive psychology interventions. And so that leads me to the next question, which is, which ones are your favorite ones that you usually apply in your life?
Oh, right. There are a few, but the ones that because I know we don't have all day to talk about it, so I'm just going to pick on a few. I love gratitude journaling. I love optimism. I love courage. I have actually, because I'm a person of faith, I've actually coined what I call God-timism. I am an unrepentant and incurable optimist. I told you a story just before we came on air about something that was absolutely impossible to the normal person. But my optimism, I said, no, we're going to get there. And we got there. So I am an incurable optimist. So that's one. But gratitude. I tell you something that happened recently to me. I lost my mother. My mother lived for 90 years. And under normal circumstances, I should be very grateful, and I am very grateful, totally grateful. My dad had passed on 5 years earlier at 91. So my both parents lived 90 and 91. So I can't argue with that. I'm really grateful for that. They lived very happy lives. They were very happy people, and they lived simple, and they really adhered to a lot of the lifestyle medicine tenets, everything you can think of. But when she moved on, I felt alone. I felt abandoned, as it were. Positive health allows you to acknowledge even those downtimes. So I acknowledged it, and I didn't know how to move on. This happened October 2021, my mother passed on. So this is the month of remembrance for us. But let me tell you how I came through that. I decided straight off that every day for the next however long, I was going to write something I'm grateful to her about. I'm grateful to God about this trait about my mother. So and I did that in my social media. So I said, I'm going to just tell the world who my mother was. And so this day I would say she showed kindness. She was a courageous woman. She was this, she was that. And then I just show gratitude for that. And guess what? There was a shift. Instead of sorrow and crying, there was a shift of sheer excitement. I don't know how it happened, but that's positive health. Yeah. As I kept on journaling every day about one thing or the other in her character strength that she passed on to me or that I saw, I was grateful. So I have used those very, very effectively in my work in life.
Yeah, certainly the area of gratitude, that activity can be practiced in many ways. And you also are a little bit describing that you have what's also called positive reminiscence. So you're remembering your mother, you're bringing that strength into you, and an internal gratitude for what your mother meant to you that will be there with you forever and is an additional strength, as you pointed out. And these situations are normal part of life. We lose loved ones. And another important area of positive psychology is the self-compassion. And oftentimes people who are maybe not so familiar with positive psychology think it's all about being positive all the time. And we say, no, not at all. True positive psychology, true positive health embraces our humanity, acknowledges our painful moments and our not so happy moments, and is still with that. And self-compassion, the practice of putting our hand on our heart and acknowledging that, and then being kind to ourselves is an application that is so crucial, especially during these times right now when all of us are faced with all kinds of adversity and threats, and what we see in the world and on the news and everywhere around us is we need, first and foremost, look into our character strengths and also have self-compassion, and then slowly look to ways to look at the positive mindset, the positive side, and gratitude helps us, and positivity reminiscence, remembering the good times, knowing they're always with us, and that we can actually have physical benefits, physiologic benefits from doing those kinds of practices. And so that leads me to the next question. So as a physician and practitioner of lifestyle medicine who loves positive psychology, how do you incorporate this into your practice? What wisdom do you have for the health practitioners, medical practitioners in our audience about how they can help their patients using this science?
Oh, that's a really good question. I heard you in a podcast recently talking about something like that. And I said, oh, that's really nice. And you were talking about, I'm not sure which university in the US now that has come up with suggesting that rather than ask patients, so what's the problem? Why have you come here? What are your chief complaints? You can start by saying, what's most meaningful to you? So here is how I I've always practiced. At the beginning, I teach medical doctors, postgraduate doctors, and I say to them, why don't you ask patients, how can I help you? How can I help you? Is there something I can do for you? Is there anything I can do to make the situation better? That's one. And then now, by the time I wrap up the consultation, even when I say it, I feel good in myself. And this is what I say to my patients. And I teach also my residents to say this to them. And I say, well, I hope you feel better soon. Oh my goodness, that statement alone. Or if it's a child, I say, oh, I hope your daughter or your son feels better soon. And then when I'm feeling really good, I say, I hope they feel or you feel better real soon. I add that real soon. And straight away, they're like, oh, thank you so much, doctor. it translates to them a lot of care and compassion from this healthcare giver, that they actually care that I feel better real soon, or that my child, my daughter, my son feels better real soon. So even in the transactions that we have with patients, I bring that in. I also bring in hope into my consultations. And not that I tell people who are at stage 4 of cancer or incurable, whatever, that, oh, you're going to recover, etc. But even in that situation, there is a way you can actually bring hope to the quality of life that they have, however long it is they have left. So in every health scenario, I also use that of hope and courage. And I tell them that half of their battle is fought when they decide with courage that they're going to make it. So I really put it on that. But like I said, my real favorite is at the beginning what I say, and at the end saying, I hope you feel better real soon.
And you're describing how we can bring positive emotions into the clinical encounter as practitioners with simple questions for our patients to find out, what matters to them, and make sure that they then understand that we're really there, and there's a sort of a mindful approach to fully being there and actively listening with our patients, even if perhaps we don't have necessarily any concrete solutions to whatever it is that they're struggling with, or concrete solutions to something like you mentioned, like cancer, where there may not be the ultimate treatment, but yet through that, again, human compassion, self-compassion, what we call positivity resonance, right? Where the two individuals, the practitioner and the patient, maybe the family members in the room, are resonating with some hope, and a powerful positive emotion, and some positive visioning, even if it's in small ways, or just minor, little, fleeting, I should say, moments of joy, even in the face of possibly depression and difficulties that we often face in patients in clinical care. So thank you for a nice summary of that. Any other advice that you have for our general audience or the practitioners about how to harness the power of positive psychology? Any resources that you recommend? How do you apply this ongoing beyond the clinical encounters?
Yeah. So first of all, something to just add for clinicians is to say that I think that clinicians need to recognize that for all the tools we have at this point, for all the pillars of lifestyle medicine that we know, which is, of course, the diet and the nutrition, which is rest, relaxation and sleep, regular exercise, avoiding toxic substances and all of that, managing stress, and maintaining positive social connections. These are all excellent and good. And I created an acronym for that that makes my patients easy to remember: dreams. I say, you dream of a happy life, isn't it? You dream of a healthy life. Think about dreams, and they catch on to that. Here is what I want my colleagues and all the clinicians to understand: that people who are happy, actually, study has shown that happy people are more likely to engage and in all of these healthy habits and to succeed and sustain any behavior change. So it is critical. I personally see positive health as the bedrock of all the pillars. And I think all the pillars must, I'm sorry if anybody's offended, but must stand on positive health or positive psychology, as some people say, because that is the enabler. That is what enables you to have a successful behavior change. It always fascinates me why people want to change, how they change. You and I for one, I know that I'm constantly wanting to be the best version of myself and wanting that for other people. So that leads me on to my next advice for clinicians. Always at the back of your mind say, I want my patients, I want my clients to be the best version of themselves. And let it start with me. I want to model what I say to them. And personally, I model positive health through dance. Dance and happiness, absolutely. I have an initiative that is called Dance with the Dog. And at the meeting 2 weeks ago, the British Society of Lifestyle Medicine, at the end of my talk, I got everyone to dance, and over 1,000 doctors were dancing to a particular music, and it went viral in the social media. Everyone was so happy. Now, I say to them, when you get a patient dancing and is happy hormones are released, he's more likely to listen to what you have to say. So I model that through the happiness that comes through dance. So please, let's model this. What was that, your last question? You asked something else after that.
Oh, yes, thank you. But first, I just want to say, I love that. I think I may borrow your idea or steal your idea next time I give a talk, if in person, or is just get everybody dancing together. I love it. Or on the video chats as well. I love that. It's the physical as well as then the emotional, and in fact, that's what we know from the science, is there is this reinforcing reciprocal relationship between all the pillars of a healthy lifestyle, including physical activity, that boost positive emotions. Positive emotions just make us want to do more of those types of healthier activities. And it's a beautiful reinforcing cycle. So I love that. And then my question was, what are some of the resources that you turn to help you, whether it's for a general audience, maybe there's some favorite books, or maybe some scientific journals for our scientific audience. What do you recommend?
Yeah, so I mean, there are lots of books now on positive psychology, and I'm so excited about that. Yours is one, Strength in the Mirror. I thank you for the opportunity to review it, be one of the reviewers before it was published. I was so excited to be part of that, so thank you for that opportunity. So that's a book straight away they can get on Amazon, and there are other books. Let people listen to podcasts. The Global Health GPHI, Global Positive Health Institute or has a podcast, and people should listen on. And when you do that, you'll see similar podcasts where people are discussing that. Those are really rich resources. And there are journals as well, which people can key into to hear the latest research findings. And I think there's something very powerful about science. No one can argue with science. When you see research done and you see systematic reviews on things like how dance improves emotions and how happiness comes through dance and how that helps, even chronic illnesses, helps the brain, helps the body, helps you sleep better, you can't argue with that. So these are, some of the resources that help me. And of course, going for conferences. I've just been referring to the British Society of Lifestyle Medicine conference I attended 2 weeks ago. Next month, I'll be going to the American College of Lifestyle Medicine conference in Orlando. And the month after that, in December, I'll be at the conference of the Society of Lifestyle Medicine of Nigeria, December 2 to 4 in Abuja, Nigeria. So amazing speaker lineups. Here is where we get all the information that we want. So I really encourage clinicians to key into these resources. And the good thing about this conference is that COVID has done is that all of them are now hybrid. So you don't really need to fly here and there. You can sit in the comfort of your home, cutting off the hotel and air flight bills, and join the conferences and learn and change your behavior and that of your patients and community.
Terrific. Well, thank you for the plug for the book, Strengths in the Mirror, and for this podcast series, which you're contributing. And again, thank you so much for this lovely interview and sharing your wisdom. As we close out this podcast, any last words of wisdom?
I just want everyone to be happy, no matter how bad any situation is. It will get better. There's an adage that says the darkest part of the night is just before dawn. I learned that when I was very little, and it's helped me. So no matter how difficult, and I'm saying this particularly because the whole world is in a state now. From what's happening in Russia and Ukraine to what's happening in the economy and finance of the whole globe. Every continent is feeling it, and everyone is jittery. We don't know what's going to happen next. there's apprehension, there's even trauma because of the uncertainty of tomorrow. Let's remember that it won't always last, and it will get better. So let's keep hope alive and be happy.
Hope alive, and things will get better. Thank you so much for those words of wisdom. Thank you for joining us on this podcast, Ifeoma Monye. And thank you to our audience for listening to this Global Positive Health Institute podcast series. We'll see you again at another one of these podcasts. Take care, everyone. Bye-bye.